Good evening. I hope we're all here with our positive energy, with all our inquisitiveness, with all our happiness and just excitement to be in this program. We're so happy at Jumbo Sports to host this program. It just occurred to us that, a lot of people buy treadmills and they really don't know what to do with it. I mean, aside from putting it on and walking on it or running on it. And so we came up with this idea to host this webinar and to say to people, this is what to do. What are you looking for? Are you looking for weight loss? Are you looking for longevity? Are you looking, whatever you're looking for, we're going to tell you how you can achieve this using the treadmill. And I'm excited because it was only after we started having this association that I realized that Coach Tony is an alumni of University of Calabar, not just an alumni of University of Calabar as I am. Coach Tony also is called the body alchemist. So he read anatomy, human anatomy. Imagine a coach who read anatomy. What else do you need but that person to tell you exactly what to do with a treadmill? Tony is really the best in Lagos. He's trained me, and going on that Tony's training is something tough, but we're going to hear from yes, Tony. We're going to hear from Tony, and we're also going to hear from Dr. Emmanuel. Dr. Emmanuel is not just a medical doctor and a pharmacist, but he is a fitness enthusiast. He's one who has worked out. He's experimented with his body on workout. And so he's just well positioned to tell us how our body interacts with a lot of things that we do when we work out and what we need to know about a whole lot of stuff. So let us get on it, okay? Let's start it. Coach Tony, I'd like you to give us some beginning introduction about what you want to tell us about treadmill. It's a freelance, just tell us what you want to tell us about treadmill. And remember, everyone, please, once you want to talk, put your hands up or, type your questions in and we will take you. I'll be asking loads of questions, but let's listen to Coach Tony right now.
Okay. Good evening, people. Welcome to this interactive webinar on how to use the treadmill and the benefits of the treadmill. I think it is easy to say that the treadmill is one of the most popular tools that we use for fitness. And why do we opt out for the treadmill? Number one, the convenience. It's very, very convenient to use the treadmill. The treadmill is a good way, getting in your targeted steps. And it gives you power over the weather. That's the home treadmill, And one good thing is this: when you are at home, you have the audacity to dress anyhow you want. You can dress in your undies. I'm not saying that you should do that, but you can really go out and do anything you want, And another thing about the treadmill is this: it has inbuilt programs. Variety. It gives you a whole variety of things to do. Like you can do a low impact program, you can do a high impact program. And one of the benefits of using the treadmill is obviously weight loss. When you train every day, even if it is 10 minutes, you will definitely lose some calories. And if you continue to do that every day, you develop a caloric deficit, and then it results into weight loss. And one of the benefits of using the treadmill? It increases testosterone. Guess what? Do you know what is linked with testosterone? increased libido. Oh yes, increased libido. You can have a rejuvenated love life if you continue to do an intense treadmill workout program. And we'll get into more benefits.
Yes, we're going to get into more benefit. Coach Tony is teasing the men. I hope it's not just the men and everybody. When you have those endomorphins springing out. Dr. Emmanuel, please have the floor and tell us. Coach Tony has told us quite a bit, and I hope we're holding on to that. Pick your pen and your paper and just keep writing, because I am writing. I use the treadmill, I use gym equipment, and I know what I suffer and what I want to know. So I'm going to be asking questions. But Dr. Emmanuel, you have the floor. Tell us what you want to give to us today about the treadmill before our question starts.
Hello all, I am Dr. Emmanuel. I'd like to say a thank you to Success for the introduction, Naomi for coordination, and our co-panelist Coach Tony, a man of uncommon charisma and work ethic. And lastly, chairing this webinar, the MD of Jumbo Sportsmart, and my elegant mother, Mrs. Umuta Mbamalu. On treadmills, they are a compact tool used by all to help us conveniently assess and achieve our fitness goals. When you walk, you run, or you jog, open or in your home's convenience in a treadmill, what you're doing is controlling your cardiovascular exertion. How fast, how far, how long do you want to run for? Do you want to strive for and achieve your maximal heart rate? Or would you like to regain confidence in your gait and perhaps regain your youthful mobility? In the hospitals, we use them alongside EKGs to perform a delicate diagnosis of individuals concerned for that might need endovascular interventions called stress testing. We get to utilize the settings on it to stimulate specific conditions. We need to assess our patient's health. This probably isn't what you have in mind when you think about them, but it does offer that robust control and autonomy. And if we can use it in the healthcare setting, how much more can you in your own home setting? I personally run before my high interval intensity routine. And when I do that, I imagine my heart pumping, sending healing to my joints and extremities, my vessels opening up and moving toxins from my visceral organs and skin, restoring some of that youth we tend to lose in our day-to-day grind. My lungs open up, regular breaths we take in and out of each inhale, and accessing our respiratory reserve, which is sometimes double the amount of air that we usually breathe in, to give support to our constantly beating hearts. I'd like to share more on why we should run on treadmills and give information on how to get into and keep that exercise mindset. I'm happy to support our panelists, answer questions, and achieve these objectives during this engaging discussion. Thank you.
Thank you, Dr. Emmanuel. It's awesome to have you here. And, listening to you just excites me, on a lot of grounds. But, I'll keep it here. Dr. Emmanuel is saying we're going to be gaining detox when we run on the treadmill because we're sweating and we are losing a lot of heavy metals from under our skin. We have blood circulation, we have blood supply to our joints. So there's so much we are gaining from the treadmill. Now I'm throwing out this open question, okay? Coach Tony, Dr. Emmanuel, they tell us before you use a treadmill, you should consult your doctor. We know so many people don't do it. Is it a broken record? Is it just something they say, or is it something necessary? Consult your doctor before you use this equipment. Why? What sort of conversation should we be having with our doctors when we want to use the treadmill?
Let me quickly jump in. As you know, Nigerians, there's an unspoken rule that ignorance is bliss. So most people do not like going for medical checkups because they are afraid of discovering what is wrong with them. You know, some people are born with congenital diseases, congenital malfunctions, but they do not know that they have such ailments. So they don't want to know. So they keep away from the doctors. But when you want to start a fitness program, it's very important for you to like consult a doctor so that you are aware of your risk factors. What are risk factors? And things like cardiovascular diseases, obesity, high blood pressure. These are things that will determine how you should train. So it's very, very important that you should get in touch with a medical professional to tell you,
Dr.
okay.
Emmanuel. Okay. Oh, sorry. I thought you had gone off. I think there's a bit of a glitch. Okay. 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 Dr. Emmanuel, do you want to have the floor? Do you want to tell us why should we see people like you before we use a treadmill? Why?
Well, I'll be happy to answer that. Let's see. Treadmills stimulate walking and running. In that case, the challenge to your ambulation, your ability to move, is based on the gravity exerted by your own weight. There is no external weight that could exceed what your body is already conditioned to handle. That is to say, the general population using these devices responsibly, there should be no issues. Now, if we consider persons with skeletal anomalies, such as vertebral malalignments and scoliosis, eroded hip joints, unrepaired meniscal or ligament tears, well, these could be worsened by performing unsupervised actions that could further traumatize the lower limb joints. And these are patients who would be able to, of course, experience very good care if it's in the hands of our own professionals like Coach Tony. Also, patients with heart issues, such as atrial fibrillation, a disorder where the different parts of the heart beat out of sync, or hypertrophic obstructive cardiomyopathy, a disorder where the heart has architectural defects. These patients should attend to a strictly regulated exercise regimen to prevent serious arrhythmias and sudden cardiac death. But otherwise, for most people, as I said previously, in the general population, 9 out of 10 people, 99 out of 100 people, you should be all right.
Yeah, I completely agree with you. I sell treadmills, and I have people who come into the shop and they want to try a treadmill. And they say, oh, no, I know what to do. I know what to do. They turn on the treadmill, and then the treadmill, they're on the treadmill and they don't know how to step. And they go on a high speed. And the next thing you see is that they tumble off. I've had near fatal cases. And so I just don't think people should see the doctors alone before they use a treadmill. You know, talk about it. If you have had a history, a health history, talk with your doctor. If your family's had health history, talk with your doctor. You don't lose anything, you know. And then I also think they should add talk with a coach. Because you see, the coach is going to guide you and say, put it on 1 and then warm up for 2 minutes and then, you know, graduate and then do this and then do that. Coach Tony is going to be telling us all about that. Now we've gone past that level about, do we talk to our doctor and our coaches before we use a treadmill? Next question I want to ask, because this is really, really important. I see friends and people around me who lose weight. But they don't lose weight going on a treadmill. They just drink juices and starve themselves and they lose weight. Now, why should they use a treadmill? Is it just about weight loss? Why? Why should you work out? Why should you do exercise as against starving yourself? And it's an important question to answer because a lot of people just think, you know, we talk about this calorie deficit, but it's not all about calorie. It's much more than that. Can you, you know, give us some light on this before we delve into the real issue of treadmill. But I really want us to make a case for workout, especially on the treadmill. Coach, do you want to take the floor?
Yes, I will.
Yeah, thank you.
I would love to add my little wisdom to it. So most people, most people have issues with coordination. They discover they discover that they can't actually coordinate themselves. So that's why people have accidents on the treadmill. They have a high expectation of themselves, but the reality is that they are not well coordinated. So it's very, very important that when you start using the treadmill, you're a beginner, you start with like you say, level 1. You start with 1. You walk first. You walk to get used to the rhythm, because you are on an elevated platform, and if it is inclined, you might have a vertical issue. Why you need to train, why you need to use the treadmill, why you need it gives you a total body tone. Sprinting, walking, lower body tone. Sprinting gives you a full body
workout. As against
workout.
juices.
As against what?
Yeah.
As against losing?
As against juicing. That's, it's really very important because, it's so important. Yes, against juicing or just diet, workout, against those. It's much more.
It's much more. Now, the thing about treadmill is this: it elevates your heart rate. It elevates your fitness level. So doing diet alone it will not tone your muscles. It's not going to happen. You're just going to have flabby muscles. So when you work out specifically on the treadmill on an incline, you get a good tone. Your lower body gets a tone. It will build lean muscle. Emphasis on lean muscle. Absolutely. Lean muscle is what you're looking to get from using the treadmill.
Yes, Coach Tony, you are having so much gray hair, but when they look at your muscle, man, yeah, that's what I'm talking about. When we use gym equipment, when we use treadmills to work out, as against just dieting, you are giving yourself life, you're giving yourself strength, you're giving yourself tone. That is the difference between an old man and a young man. Okay, and I want to pause at this point to recognize a few people. It's so wonderful. We have 53 participants. Awesome. I see Tejiri Oru. I see Temitope Adewuyi. I see Adaigwe. I see Sheyi Olulade Precious. Oh my God, I see so many people. Oluwatosi Otayomi, welcome. Obimdi Chigozie, it's nice to have you. Nurse Titi, lovely to have our nurse here. Namdio, it's so wonderful to have you, bro. Thank you for coming. It's so lovely to see Rosalind Thompson, team, Felicia, Mali, Linda. Oh my God, Linda, it's so nice to have you. Kingdom Love, whoever you are, we're receiving your love. Kabari Bako, nice to have Joy. Johnny, thank you. Jadida Foundation, lovely having you here. Ire, you came on time. You are so appreciated. Thank you, Halimat Busola, and everyone here. I am just saying thank you. Esther, you are so welcome here. And I see Dijak's Fitness is here as well. Chukunonso and Charlie's Fitness all the way from Port Harcourt. Bolanle, thank you for, I see Azuna Maido, woo, all the way from New Orleans. Thank you for joining us. So we're going back on our program, okay? Now, one of the things that make people not want to use the treadmill or to exercise is the pain. And, from our side, then the fitness side, you say no pain, no gain. And so you're saying, look, you must have pain. But, we want to know, is there a way to manage this pain? Is there a way to go around it? How do we go about it so that people are not scared? They go on the treadmill for 1 week and they're like, the next thing, the treadmill becomes a heap dump for all the clothes. And when they see it, they're terrified. Dr. Emmanuel, we'd like your voice here. Tell us, and of course, Coach, we would like to hear you also tell us, what do we do about this pain? How can we manage it? What should we expect? How do we manage it and make good of it? Thank you.
All right. To buttress off what Coach Tony and Mr. Muta have mentioned, you have to start up from a place where you can manage and then build slowly. It's like what Dr. Nietzsche mentioned. He was an old philosopher who says, one does not simply fly into flying. You have to crawl, then walk, then run, then climb, then jump, and then fly. If you look at people at the very apex of the athletic hierarchy, the Olympians, if you will, or athletes, they didn't get there in 1 day. But just imagine that by first acquiring a certain type of mindset. The same kind of mindset that allows someone to work 80 hours a week. If you can repurpose that same effort that you have, whether it's into your business or your relationship or maintaining your family home, and then prioritize your own health, you'll be able to achieve far more than you thought you were capable of. In terms of pain, pain is how you know you're alive. Without pain, how are you even sure anything exists? It's how you know where your fingers are when you stop them, how you know your toes are. It's your body's way of giving you back information. And interestingly enough, it travels along the same neuronal patterns as pleasure. But inside of that, we actually produce some endogenous painkillers. Endorphins are the most common ones. And the amounts that we produce is usually relative to how much we need. So the more you push yourself, the more you tell your body that you need to survive more than what you're already surviving, the more it reciprocates and eventually gives you a stable internal dose of these endorphins, or they're actually opioids, if you will. So in essence, what I'm trying to say is that when you do a workout or you exercise or you exert yourself and you experience pain, that is actually a green check. It means that you told your body that you have to survive beyond what you're already surviving. You've challenged your body and asked it to graduate. So that pain is positive feedback. You don't see it as that initially, but you over time develop that mindset.
Thank you. Thank you. Coach Tony, it's important. We're not doing badly with time. It's only 7:35. We're not doing badly with time. We have a couple of questions. I see Sheyi Olulade saying she needs that mindset that says pain is not bad, that pain is okay. It tells you that your body is alive and that you are responding to the exercise. That is awesome. So, Coach Tony, you have the floor.
Okay, let me just add to what Dr. Emmanuel said. So, managing pain. First of all, you want to recognize the level of pain you're feeling, on a scale of 10. If it's anywhere near 8, if it's 8 and above, then that pain is not good for you. So how can you manage the pain? So you can go for a spa day, get a massage. Deep tissue of the pain in your muscles, accumulation of lactic acid in your muscles. So doing that therapy helps to relieve the pain. And also sauna also helps relieve the pain. And when you have tight muscles, it also helps if you can do a yoga session, do a good stretch session. That way you can reduce the pain, and then you rest. You need to really, really rest. Your body needs about 24 hours of rest to recover from the pain, because every time you walk out, what happens is that you are tearing the muscles. Every time the muscles expand, you tear the nutrients go into the muscle, and then you recover. But you need to rest properly for it to make sense.
Awesome, awesome, Coach. Thank you so much. So Coach is saying the pain will come, your muscles will tear, but there's a way out. He says you can go for a massage. He said you can have a sauna session, and he says you should rest. So we must have rest days, because when we keep at it every day, we can wear ourselves out, get into spasms, get into fever. Also, wait, doctor, am I talking the truth? I don't want to say the thing that is not medical, but you know what? I went under Coach Tony's sessions. It took me only 3 days. I passed out. I didn't come to the gym the 4th and the 5th day. I had to come back after. And I think that's a trick. You know, you're paying for a whole month. You end up using only, I don't know, 3 days in a week. Coach, you have to give me back my change. Anyway, it's a nice time to recognize Jumoke and Nnamdi. Nnamdi is saying, is there a limitation as one progresses with age? It's important. It's a very, very valid question. Is there limitation to what you should do, what sort of exercise you should do, the length of time, the severity of the exercise? Is there a limitation for not just age? So I'm going to add to Nnamdi's question, not just by age, but also by gender. If you're a woman, should you do less than the man? If you're younger, should you do less than the older person? If you're a gym rat, should you do more than somebody who is just coming to the gym? We like your thoughts on this. And Coach Tony, looks like you have the floor.
Okay, there is this lady, this American lady. She's the oldest bodybuilder alive. She's over 60. I think she's around 70 now. So she started exercising because she could not walk up her stairs to get to her sick cat. So that was her motivation to work out. She started working out in her 60s. So there's no age limit to what you can do. It's all about conditioning and what you want to achieve. So if you want to train for a marathon, of course, you have to start slowly and gradually build your stamina to that level of a marathoner. I'm over 50. I'm over 50, and I do everything. I do martial arts. I'm a black belt in several martial arts. I run. I do weight training. I do yoga. I'm very, very active. So
I can attest to that. So the frog jumps you asked me to do, all sorts of crazy weights you asked me to lift.
Yeah. So
and you always do it before me, which is really important.
Yes. So I never tell my clients to do something that I've never done before. So that's the thing. So I believe that training is a good tool.
That's awesome.
Internally, you feel young. So that's one of the benefits of
I hear you,
training,
Coach Tony.
especially when you use the treadmill.
I hear you, Coach Tony. Thank you. I hear you, Coach Tony. Dr. Emmanuel, would like your perspective. Is there something we should know, the audience would like to know? Is there something we should know about age limitation? with respect to exercise? Is there something we should watch out for? Is there something gender as well? Is there something we should watch out for and know before we take on or as we take on our exercise? Any limitation as a result of all of this? Temi Tobe, thank you. I see your thank you.
So we have younger patients in their 20s that cannot handle anywhere near as much stress as someone who's conditioned and toned in their 50s can. You have people even younger that either because they're obese or they live sedentary lifestyles, they put the wrong things into their body. They've prematurely aged. So I would want to think about the problem from the reverse angle. Regardless of how old you are, how much youth can you get back? I am currently just sub 30, but I remember how I felt when I was 12 or 15 and I was bouncing off the walls, where it wasn't a second thought before I would get up. I didn't have to experience as much inertia. And I want that back. And I know that I can access that, but I have to do some things that I took for granted before. Things that came to me by default because I was excited, I have to be more conscious about it. So with your age, what you're mostly concerned with is that it becomes a little bit more challenging because of the most important muscle in your body, which is your heart. This is why it's important to, both of these two panelists I'm speaking with here, they have a past of being athletes. They've been high-performing athletes from their youth upwards, which makes it easier for them to sustain it the older they get. Why? Because there's something called maximal heart rate. The equation for it is 220 minus your age. That is, on average, the heart rate that should be your target. If you're 50, you should be able to achieve at least 170 beats per minute. Sure, you can push it further if you're more toned, but if it's less, you should be concerned. And the younger you start working out, the easier it is to preserve your heart rate. And I want this not to be lost on any of us, the importance of your heart beating. Each time your heart beats, it sends blood to every single cell in your body. Blood is life. If the heart is not beating effectively, it means parts of you is dying more slowly. Conversely, if your heart is beating adequately, what is it doing? It's sending necessary nutrients to each and every one of your cells, your nerves, your brains, your bones, and your muscles. It's sending recovery and healing. So that aside, for women in general, it's actually more important to do weight-bearing exercises, which running and jogging is included because you're using yourself as a weight. Because when you get past menopause, there's a certain hormone that goes down that you need to sort of make up for. And if you build up significant enough bone density when you're younger, you can achieve appropriate posture, height, gait, flexibility, and strength when you're further on. Basically, it's never too early to start working out, and it's never too late to, start working out.
Thank you, Dr. Emmanuel. So Dr. Emmanuel is saying to us, start early. And he's also saying to us, today is on time. Sheyi Olulade is saying the same thing. Einstein Shepherd, she's 86 and she's doing so much. Halimat is saying to us, the physiotherapists can also manage pains. They are called delay onset muscle soreness, DOMS. That's when you have pains, you can see the physiotherapist, you can see your masseuse, you can enter the sauna, you can stretch. Oh, stretch so well. I did some stretching today, but then don't be afraid of pain. When the pain comes, just say, great, I did some good workout today and my body is responding. When you're older, take your time to condition your heart. Nnamdi Owo is putting up his hands and he wants to say something. Nnamdi, you have the floor. Nnamdi, you have the floor. You can say, you can talk now. You can unmute. Maybe you're muted. While Nnamdi comes on, we're having Obin DK saying, how often should I use a treadmill for optimum health benefits? It's a question we need an answer to. How often should we use the treadmill for optimal health benefit? And then Joy is also saying, as a beginner, how many kilometers per hour should I start with on a treadmill? You responded to that, but shed more light on one's progress, please. How do I target my abs on a treadmill? Joy is saying she just doesn't want fitness and cardio. She wants her abs to be six packs like my own. Okay, and she's saying, how can we target our abs when we use a treadmill? Can I get a flat stomach with treadmill workout? Tony, you got some questions to answer there. How can one manage treadmill experience in a school environment? That's an awesome question. Guys, you have questions to answer. Where do we start from? Tony, you have the ball.
Okay, how to get a flat tummy from using the treadmill. Okay, number one, you need to start cultivating the habit of using the vacuum, stomach vacuum, holding your stomach in while exercising, while walking. It's very, very important. When you do that long enough, you find that you have a flatter tummy. Now, using the treadmill to get a flat tummy, you should go on an incline, and then you should sprint. You do short sprints, and then you recover. Short sprints like 30 seconds or 1 minute, or it might even be 10 seconds. You do an interval program. So basically what you want to do is to burn fat. So that's what the goal is. Burn fat, not really lose muscle. You want to burn fat. And for men, because of our habits, I drink beer, but I have a flat tummy. So for men have the beer belly, the beer gut. Doing the program on the treadmill will make sure that you reduce the belly fat there. So which other question is there? What other question do we have? You are muted, Muta.
Yeah.
Okay.
Joy had a power-packed question. She said, for beginners, how many kilometers per hour? Chigozie said, how often should you use the treadmill in a week for optimal benefit? And you've talked about the abs, so you've dealt with that. So how often should one use a treadmill in a week?
Well, it really depends on the individual, but I will suggest that every single day. If you have the opportunity, you use it every single day. The more, the better.
The more, the better. So what about, where does the rest come in? Don't forget, you said we should rest. Where does our rest come in?
Oh, you rest in the, okay, let's say you you walk on Mondays, and then you sprint on Tuesday, alternate days. So one day is low intensity, your rest day, so that's full rest. It should be active rest. So you are doing something, okay, fun. You are swimming, you are walking, that's your active rest. Then the next question, what was it?
Thank you.
What was the last question? What was the last question, please?
How do we manage treadmill in a school environment? How do we manage treadmill in a school environment?
Well, number one, you are in school to get an education. So that's the first priority. So time you can put in. Depends on the time you can put in. It varies with each person. Like I said, you can do it every day, you can do it every other day, but you must have a program. You should have maybe a 3-day walking program or a 5-day walking program.
Okay, so Coach Tony is saying, take it easy, have your rest days, but rest doesn't mean lie down on the bed. The word he uses is active rest. He would tell you that active rest is when you suck in your stomach and you're walking slowly on a treadmill. You'll be sweating like a Christmas chicken. That's active rest. And that 6-packs will show up. Dr. Emmanuel, we want you to take some questions together, okay? We want you to advise us on joint health as you use the treadmill. Some treadmill come with shock absorbers, some don't. We'd like you to shed some light on joint health as we use our treadmill. Ijoma is asking, can treadmill replace outdoor running and walking? So remember, joint health, we only have about 7 minutes. Joint health, and can treadmill be a good replacement for running outside? Or is there something different?
When we talk about joint health, we're concerned about, I'll mention 3 things. Your synovial fluid, which is just the fluid that's in between the 2 bones. Your cartilage, which makes up the meniscus, that's usually the shock absorber. Whenever you place too much weight between both of your joints, it's what helps it spring back out. And then the third thing would be the ligaments that support these joints. Now, when you have a BMI that exceeds a certain amount, it puts constant strain on your joints, which means every single step is putting excessive strain on your joints. If you do use a treadmill and you do exert yourself cardiovascularly, what you're doing, especially if you do this in a gridded manner, is you're trying to reduce weight, which means a chronic reduction to the constant strain that is happening to your knees. You have 25-year-olds who have early onset osteoarthritis, which is a narrowing of the joint space because of their weight issues. In the meantime, while you're addressing the reduction of your weight, what you're also doing with the treadmill is strengthening the ligaments and the tendons that attach one bone to the other. It makes sure that they're aligned, that it makes each movement smooth and concerted. It's why you have people who are able to do triathlons, like hundreds of kilometers, and they are relatively pain-free compared to other people who would just do like a short sprint and they have issues. You want to strengthen your joints, and this is not just for the knees. Also consider your back. Whenever you're moving, you're lifting, you're standing, you're walking, which is a combination of 30-something, 33 bones. Each of them also most of their cartilage, and they also have muscles that keep them aligned and keep them strong. So if you want to battle back pain, you should also exert yourself, exercise, walk out, and that would actually reduce the pain over time by rejuvenating the amount of synovium inside, which again comes with healing. The same goes for if you work out more in general and you strengthen those joints by stretching and also doing strengthening exercises, which includes walking, you're also able to reduce the pain that you experience there and build up your strength. To summarize, if you want to fight most pains in your body, the recipe is to work out. If you don't, you end up needing medication and surgery.
Thank you, thank you, thank you. I hope you got the answer. if you're already a runner, you can run up. That's what Coach Tony is typing in for us. And somebody is asking, can a pregnant woman use the treadmill? Blessing is asking, can a pregnant woman use a treadmill?
It's actually recommended for pregnant ladies to stay relatively active. It improves blood flow and circulation to the fetus, and it also makes sure they stay within a specific weight range. If you're too large, it's not good for the pregnancy. If you're too small, it's even worse. You can end up having a small fetus. So exercises that are not recommended for a trampoline or something called hot yoga, which is a very extreme version of yoga, because these increase the risk of miscarriages. But in general, using a treadmill at a reasonable speed where you're not afraid that you might fall off is actually pretty much strongly recommended, especially because you're pregnant. You might not want to be in certain spaces, or you might have a wardrobe concern. So I would strongly recommend using treadmill for pregnant ladies.
Thank you. Pregnant ladies can use treadmill. Again, like we earlier agreed, see your doctor. So if the cervix is a bit weak, they can tighten it and make it stronger and show you what to do and how to go about it. If Namdiowo has another question, we're going to take this question. We still have like 2 minutes. Namdiowo is saying treadmills, that's aerobic exercise versus weight training and aerobic exercise. Which is better after the age of 50? And Johnson additional is saying, what age should the children start to, at what age should children start to use treadmill? And Eze Obi, welcome on the seminar. Is there a treadmill designed for a particular exercise, or does it go for all exercises? So Coach Tony, that is your call. We have just about a minute, round up.
Okay. Let me have the question again.
Namdi is saying treadmill versus weight exercise for people over 50. What do you say?
Okay. It really depends on your conditioning. If you are someone that has been training from your youth, and you've been consistently doing that over the decades, and then you continue with your high intensity exercises, you can easily continue with your strength exercises. But it's always advisable, for you to never stop using the treadmill, because it's our go-to machine for warming up. Anybody that does any form of active workout uses the treadmill. It's the first thing you do. It's the first thing you do before you do any other thing. You go on the treadmill. So I will favor the treadmill over any other form of machine or exercise for people over 50. But then again, it's
here
preference.
You go, Coach. Yes, Coach. Good. We are on the dot of 8 p.m. and we are so blessed to have everyone here. It was a 1 hour packed full webinar. We have Mrs. Joy, Roslyn, Naomi, Namdi, Nastiti, Ogechi, Omo, Victor, Precious. We are so glad you were here, Sheyi. Thank you for the power behind the power. Silva, Stella, Mary. Oh, Stella, I see you. Temitope, Tony. Tony, of course, you are our panelists. I hope that we were able to get something out of this webinar. It's important for us that we just don't use the treadmill, but we're able to get something out of it. If you have more questions, please write them out, send it, register, send them, and we will send your answers right back to you. Thank you so much for being here with us. Uzama Okamaka, Esther Ugu, thank you very much. Victoria, thank you so very much. I am so blessed to have everyone here.
Thank you.
Thank you, Jadida.
Thank you, Abella is here.
Sorry?
Thank you, Abella is here.
Oh, Ebere, I didn't know it was Jadida Foundation.
That's the foundation.
Oh, Ebere Okoye, thank you so much for being here with us.
Lovely,
thank you. I hope we had a good time. My last word, I wanted to have the panelists say their last word, but take this home. When you start working out, your first 1 to 2 months, only you will realize what is going on in your body. When you start to use the treadmill, only you will realize what's going on in your body. In the 3rd and 4th month, your family and friends will say, it looks like something is going on here. On the 5th and 6th month, guess what? People will start saying to you, I beg, cut soap for me, cut soap for me. What is happening? Give me your formula. You know, how many of us can hold on? How many of us can hold out to the point where people will say to you, show me what you're doing? Consistency is the name of the game. Like our coaches told us, try, start small. Don't, get on 100 on the first day. Start small, be consistent, and grow. Treadmill will help you build muscles, tone yourself. It's not enough to diet. It's not enough to drink juices. It's better that you use the treadmill because you're having detox, you're sweating out a lot of things, you're having blood circulation, oxygen is going to all of your cells, and you are getting healthy and super strong. You are able to sleep. The Bible tells us when we work hard, we sleep like a laborer. The laborer's sleep is very sweet. So let us take time to walk on the treadmill. At Jumbo, we have all sorts of treadmills. Ezekiel will be coming on for anybody who is still on to tell us exactly Ezekiel, are you here or are you not here? We have a great time. Yeah, Ezekiel is here. Ezekiel, go ahead and say what you want to say.
Oh I am so excited at this webinar. I must say it has been awesome. Listening to Coach Tony, listening to Dr. Emmanuel, listening to the contributions, the questions were very empowering. Congratulations. I'm very excited to everybody. Thank you so much. Precious for organizing this, Peace for organizing this. I think you've done a wonderful work coordinating. Thank you, ma'am. I'm very much excited as regards this, and I must say this. This is part of so many things at Jumbo. We are aligning towards wellness, health, fitness, and fun as well. Earlier in the year, we've done something as regards the International Women's Day. We did something as regards the Cancer Awareness Day. So we have so many events coming up in the year as well. So I want to sign up, look at our website, check up on social media, visit us in our store. We are all spread, across the federation. Visit us to know what's going on. Currently, we are having a treadmill events, treadmill campaign. So we want to take advantage of that. And also subsequently in the year, we'll also be having so many other events. So take advantage of that. Be part of the Jumbo family. Be part of the whole exercise, the whole activities towards wellness, towards confidence, towards fun. We hope you'll be part of this community going forward. Engage us on social media. If you're not yet following us on social media, please do that. If you're not yet signed up on our newsletters, receiving information concerning our event, please do that. We've put something in the chat box regards a form, so please fill and just be part of what we are doing in the Jumbo community, in the Jumbo family. Thank you so much. Really enjoyed the webinar.
Thank you, Ezekiel. Thank you very much for this.
Yeah, muted if you are speaking, ma.
Yeah, so the last thing I want to say is thank you. Thank you to everyone who's come on, who's made this dates with this time out with us to listen and is hanging on with us up to this point. Thank you, Adeze Wanko. I see you, Adaigwe. I dobale for you. Thank you so much. Thank you to our panelists. Dr. Emmanuel, you did wonderful. Thank you. Thank you, Coach T. I'm coming back. Please don't punish me in the gym. Oh. Thank you, everyone. At this point, we sign off. Coach T, you want to say something? Your hand is up.
Oh, yes. I just want to quickly add something before people leave the chat.
Yes.
The activities that you can do on the treadmill, you can walk on the treadmill, you can skip on the treadmill, you can dance. You can actually dance on the treadmill, you can squat, you can lunge, you can walk backwards. All of these are good activities that you can do. It's not just sprinting, And then one of the benefits, I just want to quickly talk about the benefits of using the treadmill. People want to know why.
Coach T is so passionate. Okay, go. 40 people.
Loss, muscle building, reduce stress risk factors, lowers bad cholesterol, you get better sleep, you improve your cardiovascular, increase speed, increase lean muscle, reduce depression, reduce blood pressure. These are valid reasons for you to get on the treadmill. So I just want to quickly point that out for people, for the rest of the people that are still on.
Thank you.
Yeah.
Thank you. Thank you. If you want good sleep, if you want to chase depression away, that is one awesome way to do it, using the treadmill. So if you want to know more about treadmill, ask me. I already have the blood flowing from the doctor and from the coach. Me, I sell them. Just come to me and I'll tell you exactly what to do. And we're having a promo right now. So go on our website, there's loads of promo on treadmill. You're going to get up to 35% discount on treadmill. So thank you for making it a day with us. Thank you for keeping this date. I love you so much. Thank you. Thank you, thank you, thank you. We'll be announcing other programs we would have. Thank you, Adeze. Yes, you can learn language when you are on the treadmill. Oh, yes, you can have your app on. And we have treadmills that have Wi-Fi, that are Wi-Fi enabled. So you can do whatever you want to do, text, write, and just keep going. Thank you. Simply listen to music and just, and then even spend time with your friends on the phone talking. Yes, you can do that when you're on the treadmill. I hope you've been inspired. I really hope you've been inspired like I am to, keep going on. Don't stop. Don't stop till you get your result. Even when you get it, that is just the beginning. Thank you, CJ. You said you're glad you attended. I'm glad you did. Thank you for making it a day with us. Thank you. Yes, absolutely. We make it a lifestyle. Thank you, everyone. Thank you, Anita, Ijoma. Thank you, Bashir. Thank you, Azuna. Blessing. Thank you, Emeka, Esther, Ezobi. Thank you, Halimat. So lovely to have you. Ifeanyi Chukwu. Thank you. Thank you, Ikani, Andy, Ire. Thank you. Enjoy. Thank you. Thank you, Linda. It is so cool to have you, Linda, here. Lolo Jennifer. Lolo, I twirl like this for you. Thank you for coming. Thank you, Mr. Tim. Thank you, Obim DK, Ogechi. Oluwatosin Otayomi, Ekushe Gongoni. Thank you. Omorui. Thank you. Made out time. Thank you, Paul, Precious, Silas, Temitope. Temitope, I know the chemistry. And I understand. Thank you for joining us. Thank you, Tony. And Ozamaka Ugu, thank you. Thank you so much, Victoria. And it was lovely having everyone here. I hope we all got the gist about treadmill. Long life is important and we must give back to ourselves. Pain should not stop you from using the treadmill. Age shouldn't stop you from using the treadmill. Whether you're a guy or a girl, shouldn't stop you from using the treadmill, whatever. Even people who are ill, I was ill, I had surgeries, and the doctors would tell me, get up and walk. Get up and walk. And when I do, I walk from my bed to the door. They're all cheering me. What do you do on the treadmill? Is walking. So you can imagine how useful, how wonderful it is to be on treadmill. Thank you very, very much. Thank you. I appreciate every one of us.
Thank you so much, ma'am. Thank you everyone for coming. Thank you, thank you, thank you. I believe we've learned a lot. Thank you for joining us. Thank you for having a wonderful time with us. I want to say, do have a wonderful evening and great weekend ahead. Until next time, stay healthy and active. Goodbye, everyone.